5 webinars related to project search programs. Today we have with us Julie Christensen and Melissa Panisse. The title of the webinar is Promoting Health and Leadership in Project Search Programs. A little bit about their program. People with disabilities experience poorer health than the general population and alarmingly higher rates of obesity and related conditions. The University of Cincinnati, UCEDD, and Strong Center for Developmental Disabilities at the University of Rochester implemented and evaluated the evidence-based HealthMessages curriculum with Project Search students. HealthMessages is a 12-week health promotion program which uses peer-to-peer facilitation to learn about physical activity and hydration, as well as making healthy choices, lifestyle change, and setting goals. This presentation will provide a summary of lessons learned from the pilot project. A little bit about the presenters. Julie Christensen is the director of Iowa's University Center for Excellence in Developmental Disabilities. Center for Disabilities and Development at the University of Iowa. Prior to joining CDD in May 2016, Dr. Christensen served as the Director of Employment Programs at Strong Center for Developmental Disabilities at the University of Rochester Medical Center. Dr. Christensen's background encompasses work in schools, not-for-profits, government, and higher education. Her research is in the areas of employment, quality of life, and leisure and recreation participation of adolescents and young adults with intellectual and developmental disabilities. The second presenter, Melissa Panisse, is a Senior Health Project Coordinator for Health Disparities at the University of Rochester Medical Center, Golisano Children's Hospital. She previously worked at the Monroe County Department of Public Health, where she worked in the Communicable Disease Control and Prevention Division. Melissa's public health interests include data-driven quality improvement and access to health care for vulnerable populations. We are recording this presentation. We will also make the presentation, the PowerPoints, and the captioning transcript available to you after this webinar. It will be emailed to you. For the attendees, it will be emailed directly to you. So no need to take notes if you don't want to. If you have any questions, please hold them for the end. We're going to have about 10 to 15 minutes of question and answer at the end via question and answer box. I will moderate it and make sure, since we cannot open up the presentation to voice questions, since there's a large attendee list, we want to make sure that the audio is it remains clear. So we want to make sure you put your questions in the question and answer box. Alrighty, I'm going to pass the presentation to Julie, and she will take over. Julie?
All right. Well, welcome everyone. Hopefully you can hear me. So if you're not hearing me by now,
we can hear you.
Perfect. Okay. So thanks for joining. What I want to do is give just a little bit of background on what our project was, why we did it, sort of how it came about, and also a little bit of an orientation to project search as it relates to the implementation and direction of what we were trying to accomplish. And then Melissa is going to walk through some of our results, and we'll wrap up with next steps. But I do want to acknowledge that this project that we're going to talk about was actually a partnership between the University of Rochester and the University of Cincinnati, UCEDD, or University Centers for Excellence in Developmental Disabilities. I was at the Rochester UCEDD at the time that we did this project and have now moved over to the Iowa UCEDD, but still continue to collaborate with Melissa and Erica and Ilka. So just wanted to give credit to the folks that were involved in this project from conception to data collection and continued work moving forward. So just to back up, as Jasmina mentioned in my introduction, I have been heavily focused on disability employment for the last 10 to 12 years, and had the joy of having a next-door neighbor who is as awesome as Melissa is at the Rochester UCEDD, who was really focused on health disparities. And we had some conversations about how to connect the dots and ensure that as we talk about disability employment, we're also talking about health and health indicators and thinking about health transition, and then vice versa, as we're talking about health, that we're also paying attention to the ways in which employment for people with disabilities helps promote positive health outcomes as well. So that was really the impetus for where we started, and really had a desire to try to connect the dots between the two, and really thinking about the transition age as a great opportunity to address both health transition from pediatric to adult care and everything that goes along with that, while simultaneously thinking about the transition from school into the world of work and all the supports and systems that go along with that. So we were doing quite a bit of work in partnership with Project Search around transition to work in New York State. At the time, we had, I believe, 17 programs that were operating that were really focusing on moving youth in the 18 to 21 year age range from school to employment. And so within the context of Project Search, we had a real heavy focus on increasing employment outcomes through the intervention of staying or participating in a Project Search program for a single year, and I'm going to talk a little bit about what that looks like. And when we started to conceptualize how to connect the dots to make sure that youth in transition are also thinking about a healthy life, a meaningful life, that we're talking about overall well-being, we're thinking about decreasing some later life negative health outcomes, we started to ask the question about, could we infuse health literacy concepts within the construct of a transition to work program? And that really was what this particular project was designed to do, was to test that out and get feedback from youth in the process, as well as from instructors and job coaches who were involved in Project Search. So what I wanted to do is just take a couple minutes, because I don't want to make any assumptions that everyone on this webinar knows about Project Search. So I don't want to turn this into a Project Search 101, but I do want to give just a little bit of context so you can visualize the types of classroom and business settings in which we were implementing this particular program. So Project Search, at least for the purposes of our discussion, was a high school transition program. There are also adult applications, but for our purposes, we were looking at high school transition programs where students between the ages of 18 to 21 were spending their last year in school fully integrated into a business setting, working on internships and learning both sort of the hard and the soft skills needed to transition into competitive integrated employment. So the goal of Project Search is employment. So I want to reiterate that that's sort of the context in which we looked to infuse health literacy concepts. So we want a Project Search student to gain competitive employment in a fully integrated setting. A successful Project Search outcome is defined as someone having gained employment working 16 hours a week or more year-round in a job that is minimum wage or better, essentially earning the same amount of money that anyone else doing that body of work would also be paid, and that these are community-based, fully competitive and integrated jobs. So Project Search has a number of attributes that we really liked in terms of the collaboration, the ability to braid funding to create sustainable programs, but really the idea of this full immersion process that students, even though they were still technically in high school, were not in a school building but spent all day, every day in a host business where they had to meet the same conduct and dress code and everything else standards of the host business, and have an opportunity to train in real work settings and get ongoing feedback of their progress along the way. So Project Search, because of the model, it really is looking to take an entire school year to prepare interns for challenging work, for marketable skills. They have a full year to really build up, so there's 3 internships through the course of the year, and the goal is that by the end of the school year they have built up to the ability to work a minimum of 16 hours a week, that they have the skills that are valued in the workforce, and not just the ability to do the job, but also how to just interact in a workplace, how to get along, how to take feedback, you know, all those other aspects that we think about in the world of disability employment we refer to as soft skills, and do that in a collaborative manner. And that really is the core component of Project Search. And so this next slide is a visual of the different partners who are at the table in a Project Search program. So at the center is the young person with a disability, but we have a school partner who's providing a special educator and support staff. We have vocational rehabilitation and developmental disabilities state agencies, which are blending vocational rehabilitation and Medicaid dollars to help support the job coaching. We have a supported employment agency who's providing job coaches. The family is at the table, and then various other entities that all make up the Project Search collaborative group that is working together with the goal of helping students transition into the world of work. And so when we look at this visual and think back to our purpose of really being interested in this connection with health, one of the questions was, within this type of a construct and within with these partners at the table, how translatable is it to think about health and health outcomes when you have a program model that is so heavily structured on the world of work. And we'll talk about how that plays out, or Melissa will talk about how that plays out in different areas, depending on your host business, depending on your partners, and how we structured that. But briefly, it's a one-year program, 10 to 12 students. I mentioned there's an instructor, there's a job coach coming from a CRP, all working together within the Project Search year, which mirrors and follows the school calendar. So it's a little bit different in states. Some states start school in August, other in September, but generally speaking, you're looking at the school year with up to 3 internships that last roughly 8 to 10 weeks apiece. The internships build on each other with the goal of increasing the complexity and the skills that interns are exposed to over the course of the year. But the other piece of Project Search is that because it's also a school program, there is a classroom component. So at the beginning of the year, there's a full orientation process, and then in between each internship, there are these transition weeks where students are back in the classroom. So that was interesting to us in thinking about that classroom component of this model, and could we infuse a health literacy curriculum into the classroom without it detracting from the overall goal of employment being the outcome, and was it feasible, and did that make sense? So typical day for Project Search students, they start and end their day in this classroom setting. They spend the majority of their time on internships, but they do have this employability skills training time in the morning, and every program's a little bit different, but roughly an hour, and then again a half hour at the end of the day. And that was sort of the time frame that we were looking at trying to fit this into, and working with Project Search teachers to see, you know, how we could integrate health literacy into that type of a model. And then just a little bit more information about the internships themselves, but just really to give you a sense of what Project Search is. Project Search does follow a curriculum, and on this slide, the number 7, health and wellness, I have highlighted in red because health and wellness is actually a new aspect of the Project Search curriculum, relatively new. So back at the time that we implemented this project, health and wellness was not yet on the final list of things for Project Search classes to focus their attention on. So really, when we started out with this pilot project, we didn't have a lot of resources to fall back on in terms of how this looks. And so we've been really excited to work with Project Search and the national team on what we did, what we found in terms of results and the feasibility, and then what that means for Project Search as a whole as an international model with, you know, more than 500 programs worldwide. But what I love about this is that Project Search in partnership with Beth and Jasmina and the HealthMatters project really were interested in this intersection between work and health and recognized that that connection was really important for outcomes on both ends of the equation. We're not going to have good employment outcomes for individuals with disabilities if their health care is not also taken care of, but conversely, we know from the literature that those individuals with disabilities who are working tend to also have better health outcomes. So it just makes sense that we're finding a way to connect the dots. So overarchingly, our guiding questions going into this project, which Melissa's going to take over here in just a sec, were to look at how we could deliver content without being a burden on our instructional staff. And remember, our instructional staff are special education teachers, but also job coaches who may or may not have a background in health education. So how can we, what content can we provide, how can we deliver it that isn't overburdensome to the team who has a lot of other things they need to accomplish in a Project Search year, and do it in a way that doesn't take time away from the employment readiness piece. And then separately from a student perspective, would Project Search students understand the relationship between health and employment, or would the process of infusing a health literacy curriculum actually be a distraction or a disconnect from the rest of what they were trying to accomplish by entering a Project Search program that is very clear that the outcome is employment. So that's, I think, a little bit of an overview. I'm going to turn it over to Melissa, and she will walk through what we did and what we found, and then we'll come back around and tell you what our next steps are.
Okay, can you hear me?
Yep.
Okay, great. So let me just take you right to our next slide. So the project goal, like Julie was saying, is to evaluate the delivery of any kind of health promotion information in this particular transition to work employment program. And we wanted to look at both process and outcome. So, you know, does it work to do this in a normal workday, or would it be better as a pullout? And we also wanted to look at how are the students taking in this information, are they improving their knowledge and their behaviors? So our approach was we went with the HealthMessages curriculum. We liked the idea that it seemed like it could fit right into a 30-minute time frame. Looking at their daily schedule, it seemed like, you know, if I was in there once a week for 30 minutes, that would probably be acceptable, and the teachers seemed to find that acceptable. And we also liked the peer-to-peer aspect of this curriculum. So again, building on the established structure of Project Search, we wanted to get involved with the instructors and the students, as a UCEDD, coming in there with some health knowledge and providing the support that the instructors and the students might need to get this curriculum rolling. So what is HealthMessages? We've mentioned it a couple times. It's a 12-week peer-to-peer health promotion curriculum. It focuses on increasing physical activity and hydration. And then the secondary focus, the way that the curriculum is built, allows for students to build leadership skills and also work on goal-setting activities. So when we say peer-to-peer, what we mean is that it's being taught by the students themselves. So the way that the curriculum is built is that you identify a healthy lifestyle coach to act as a peer educator. The way that we did it both here and in Cincinnati was we wanted to sort of like spread the opportunity around. So instead of identifying one or two natural leaders, we actually opened up the opportunity to be the healthy lifestyle coach week by week to every student. This was really interesting. So Julie mentioned that the classes are about 10 to 12 students, and in a 12-week curriculum, you know, it kind of naturally works out really well that every student, if they want to, would have the opportunity to do it. And I have to tell you, in all three of the classes that I sat in on, you know, there seemed to be a couple of students where you thought, you know, that student may not end up volunteering to do this. And in every one of those classes, those students did volunteer. So by the end of the 12 weeks, we had every one of those students to stand up to say, you know what, I am going to lead the class today. So mentors, so meaning the teachers of the classroom or the UCEDD staff were there to provide support. And so the way that it works is that every week there is a script. So the student has a very simple guide to use. And then there's also supporting materials. There's sometimes a poster with information, or there's, you know, the empty can of soda or the empty water bottle to help students get an idea of, like, what does 12 ounces look like and how much sugar is in this can of soda. So really nice supporting materials that work really well for the students. Let's see. So our evaluation plan, we mentioned this is a partnership between Cincinnati and Rochester. So at the two universities, we each had 3 project search classes that we chose to focus on. In Cincinnati, they were based at Xavier, Fifth Third Bank, and the Cincinnati Children's Hospital. And here at Rochester, they were at the University of Rochester Medical Center, Wegmans, a large grocery store in our region, and the City of Rochester governmental offices. So to do this project, this is interesting. We had 2 different IRBs, and so 2 different IRB requirements. The Cincinnati IRB, they provided a waiver of consent, so they didn't have to get consent for the students to participate. Our IRB wanted us to do consent. And so this is always interesting in our field, sort of addressing that issue of adults with intellectual disabilities and capacity to consent. So what I was able to do, again, it was a minimal risk study, but I was able to do a consent form with them and also a capacity to consent assessment, which for us was, I think it was 5 to 7 questions, multiple choice, running down what we went over in the consent. What is the program? What are you going to be asked to do? Do you have to do this? You know, questions like that to really ensure that the students understood that they didn't have to do this. This was totally optional. They didn't have to participate in any given class if they didn't want to. But it was important for our IRB to see that we really made sure that the students knew that they didn't have to participate if they didn't want to. So for data collection, the HealthMessages curriculum comes with some really lovely surveys right in the back. So we ended up using those. There's a Time 1 survey, the pre-project, and that includes general knowledge about physical activity and hydration. It asks a bunch of questions about social support, you know, so asking students who supports you to get to the gym, who supports you to eat healthy food, things like that. So that really gives us some nice information perhaps for a next step to see, you know, what are students dealing with in terms of healthy lifestyles? Do they have people they can bounce ideas off of, or can they take a walk with someone? And then there are questions also about health behavior, so we were able to see if there was a difference between the first survey and the second in those kinds of items. Weekly self-review. So one of the main components of the curriculum at the end of every session is the opportunity to set a goal based on what we learned in that session. And then the next week, we would spend the first 5 minutes or so going around the room and saying, you know, what was your goal last week? How did you do with it? How did you track it? I would set a goal right along with them, and, you know, we would talk a lot about that. You know, you set a goal on Tuesday or whatever, you forget about it by Friday. So we would talk about ways to remember, ways to track our progress. We did post surveys using the same surveys from the curriculum. And then at the very end, we did focus groups. So each of the 6 classes had their own focus group, and then we did teacher focus groups, 1 here with the 3 Rochester teachers and 1 in Cincinnati with the 3 Cincinnati teachers. So to implement the project, you know, like 12 weeks, so it ended up being about 13 weeks, 14 with the introduction and the focus groups. So day 1 for me was going in, introducing, and getting consent. Cincinnati just had to introduce. And then we went through the structure of the curriculum. The first month is about making healthy choices. The next month is changing lifestyles. And the third month is about how to maintain your lifestyle and the changes that you've identified you wanted to make. So looking at who participated, we had 53 students between the 2 sites. 64% were male. We actually had some nice racial diversity, which, you know, in our setting we see a lot more white students sometimes, but this was a nice and diverse group between these 2 settings. 77% had completed high school, 15% had received a special education diploma, and 8% had completed some high school. This is a very simple look at the survey results, so we sort of like graded them on a 100% kind of metric, the way that you would a normal quiz. And so they're looking at the 13 questions about general knowledge around physical activity and hydration. We found that 62% of those who took both surveys did demonstrate an improvement. So the average score on time 1 was around 70%, and then as we got into time 2, it was around 80%. So it was nice to see that there was improvement between the 2 surveys after all of the curriculum was done. In terms of satisfaction, the students, for the most part, were really happy with the opportunity to do this. Looking at, would you recommend this to your peers? Most of them would recommend it. Some of them were, a little less enthusiastic, but I said might recommend, and only 2 of them said they would not recommend it. In terms of was it worth your time, almost all of them found it at least somewhat or totally worth their time. So that was nice to see. The surveys also come at the time 2 survey. There's some open-ended questions about, how did you like this? And so we were really interested to see what kind of comments we got sort of outside of the focus groups where they may have been more hesitant to speak. But so some of their favorite experiences were teaching the class. So like I said, this opportunity to demonstrate leadership was really important to the students, and I think it was really refreshing for the instructors to get a little bit of 30 minutes to get some work done while the students are teaching the class. They liked learning how to eat better. They liked learning about drinking more water and different exercises. I think they really enjoyed the opportunity to think about soda versus water and sports drink versus water, and you talk about that a lot in the curriculum, and I think a lot of the times, in our culture, we're just raised with so much soda that once you really start to think about that habit, you start to consider how you can make changes in your behavior. The goal setting was another favorite thing. So the students got to make a goal, and they got to share their goal if they wanted to. Not all of them did, but it's kind of nice to say out loud, like, this week I'm going to take the stairs instead of the elevator. So sharing the goal, talking about it next week, is really helpful for them and sort of like building their confidence to say, I can change this behavior. Healthy snacks. So the Cincinnati group did a healthy snack rotation. We didn't do this in Rochester, but the instructor there would bring healthy snacks to class, which I think is really helpful for students to get an idea of things that, they may see on the shelf but don't want to spend the money on if they don't know if they like it. So in that setting, they were able to do that. And they also just liked how positive the curriculum is. So it doesn't come at you to, from a place of deficit. It tells you, like, this is something that you can do, and why don't you set a goal and give yourself a little challenge. So those positive aspects were really nice in keeping people engaged and feeling good about their activities. Some things that could improve the experience, they really wanted more information about exercises. And I think, we did have conversations about, exercise doesn't mean you have to go to the gym. It can be a walk on your lunch break. It can be riding your bike after work. And so helping students consider the things that they like to do that would promote them to do more exercise. Nobody's going to do an exercise that they don't want to do, and you're not going to stick with a program that you dread. So helping them, again, I had a student who was really interested in skateboarding, but he just like didn't see that was exercise, so it was fun to kind of encourage him, that you can go skateboarding and that is exercise and that counts to your goal. Trying the food items, again, that was a Cincinnati effort with the snack foods. Walking more, so this is setting dependent, of course, but in both the University of Rochester setting and I think it was the Children's Hospital in Cincinnati, because it's a giant medical center, there's walking routes, by nature, walking the halls. You don't have to go outside. We have horrible winters here and in Cincinnati too. So you don't have to be outside. You can walk this mile loop in the hospital. It's a little less easy to do that in some of the other work settings, like you may not be able to do that at the grocery store. It may be better to go outside in that kind of setting, but realizing that you can do that on your time off and get some some points for exercise is one way of doing it in the work setting. Students wanted it to be a little more challenging, and you'll see that a little bit in the instructor comments too, that, you know, the curriculum is nice. It gives students the opportunity to teach the class, and the students who, you know, were a little more interested made the class a little more challenging than some other ones. But it would have been nice, I think, for some of them who had more interest to have assignments or something to do in the week in between other than just working on their goal. And then they wanted, in general, just more information. We want more detail. And it looks like, you know, that 8 a.m. time was a little tough, so a little wake-up exercise or a stretch might have been nice. So from our instructors, we heard, again, this concept of a wider variety of activities, recognizing that, you know, students in the class have different abilities and also different interests. There are different learning styles. So, again, having the opportunity for an assignment, I think, in the interim week would have been nice for those students who were displaying an interest. They wanted to broaden the content, so I've mentioned a couple of times that this curriculum focuses on hydration and physical activity, but you know, what was really interesting in an employment setting was, let's talk about nutrition, because what are you going to bring to lunch? You have 30 minutes, you know, especially in a grocery store, you're surrounded by really good food and also a lot of junk food, so how could we have helped those students in that setting think about what they can do during their 30-minute lunch to eat better? Managing healthcare was something the instructors thought would be helpful, especially given that these are transition-age students. How do you move on from that pediatric environment, you know, where your parents are making all the phone calls, dealing with all the paperwork, things like that, that as these students transition to adults, they're going to need to know how to do on their own. So that might have been a nice, Project Source is a nice setting for that kind of health education. And again, this peers as the teacher component was really valuable. It helped them with their leadership and their self-advocacy skill development. You know, and it was a really low-pressure way of doing it, but you could just tell that the students really did find it valuable and found it exciting. So I'm going to pass this back over to Julie.
Okay, so just to kind of bring us full circle in what we learned, and to go back to, you know, part of our original reason for doing this was that we really just wanted to see, you know, is there a feasible way of doing health literacy, incorporating health literacy within a very specific transition to work model, and what might be the barriers to doing this. So one of the things that we did note and was pointed out to us is that the instructor engagement and physical fitness itself was a factor, and that was not something we necessarily surveyed for up front. We selected 6 classes, we had 6 different instructors, and there was great variation in how in-depth some of these individual classroom implementation strategies went. So when Melissa talked about, you know, there were some instructors that really got into different healthy eating options. You know, that's an example of just going kind of that next step. So one of the things to think about is what additional resources and strategies might need to be provided to instructors who may not be particularly physically fit themselves, or maybe they are, but it's just not a topic that they feel comfortable talking about, or you know, they don't see themselves as health or fitness experts, and what resources and supports can we provide so that it's just a more comfortable topic. The other thing that really impacted the program at the individual level was the business commitment to health and wellness. So for example, the Wegmans program, being a grocery store, and Melissa's right, you know, when you are in a grocery store and you have access to the Twinkies aisle, you know, and having to make healthy choices, you know, that's one aspect of it, but Wegmans as a corporation has a strong commitment to physical fitness. So, for example, there are times during the day that they will just announce over the loudspeaker at a Wegmans store, okay, all employees, it's time to do our, jumping jacks, and any employee in Wegmans just does 10 jumping jacks as a way to be physically fit and active as an employee, but also to model to customers that are in the store aspects of healthy living. So contrast that to a really large medical center that may not have an overarching health and fitness culture, but may have it in pockets in different departments. So the business itself played a huge role in how well, well, not to say how well, but to what extent what we were doing in Project Search classrooms could be reinforced in other ways. So a takeaway from this was also to look at ways to engage the host business and wellness activities and to think about actually having our students be ambassadors within the departments where they're interning to also promote talking about health and wellness broadly as something that the business community should pay more attention to. Our other big question in all of this was feasibility, and what we came away from was to say, yes, this is definitely doable. The 30-minute lessons were adequate. Everything that Melissa said in the upfront, it's easy to fit this type of a program within a Project Search structure or other transition to work programs that follow kind of a similar model. Doing that, sort of 12-week program made a lot of sense. However, you do need a champion to help coordinate and facilitate, and it might not be the instructor who's the best person to do that. So, thinking about your transition to work team and who is the person that feels more comfortable, or if there's not someone, is there someone within the host business who could be a champion, or is there an external partner that can take this on, a partnership with a local gym or a not-for-profit, or even since these are school-based programs, are there ways to get your health and physical education staff involved where they could maybe push into the classroom and help provide supports. All of those are different options. We do want to note that in the case of these 6 sites where we piloted this, we did use UCEDD staff to push in and support the project. So we were not asking the instructors and the job coaches to do the implementation of this project. We were doing it for them, and that's just another consideration. We are not able to really address the time factor and what that would mean in terms of adding the concern of adding one more thing to a special educator or a job coach's plate. And then overall, I think we just realized there's no one single approach to this, and that you do need to customize your implementation based on your program, based on the staff in your program, based on the students, and definitely the culture of your host business. But the biggest piece was the consistency from week to week and the ability to hold students and staff accountable to the overarching goals of the program. One of the things we didn't say, but I will point out as we've started to look back at the data again, is timing of the year. So in our case, we implemented this program during the 2nd semester of the school year, and one of the comments that came back from some of the instructors was that they really wished this had been something that was kicked off right at the start of the year, because it is a 12-week program. It's limited, and so they really liked the idea of having that be at the start of the year, so that there could be ways to incorporate health and wellness the whole year and have it be part of the program overall and not just kind of limited to this time frame. So that's another thing to consider. So some recommendations from our perspective is wanting to raise awareness of existing work-based resources and wellness programs, looking around within the host business and within the community and finding ways to connect those, making those connections to community-based resources and helping to model. So again, Project Search is a school-to-work program, so part of the conversation is, in the workplace, you don't get to start and end your day in a classroom where you might have an opportunity to talk about ways to incorporate health and fitness into your day. So how do you fit health and fitness into your work day? And then what else do you need to do outside of the work day? Join a gym, join a club, get out on your own, go for a walk at the end of the day, get up early if you're a morning person and walk the dog, all of those other pieces of thinking about health and fitness as being part of a lifestyle and not just kind of a set of activities that you schedule. And then the other piece is about broadening the topic. So I did want to say that HealthMessages, as a separate curriculum from the HealthMatters broader curriculum, is really focused on hydration and physical fitness. And we knew going into this that hydration and physical fitness is only part of the conversation. So the HealthMatters curriculum is much broader and has a lot more to offer in terms of topics of interest. And we did not go there for the purposes of our pilot because what we were really interested in was the structure of the HealthMessages curriculum, the peer-to-peer piece, the short lesson plans, the once-a-week model of being able to push into a transition to work classroom. So certainly for us, when we think about moving forward, you know, how do you take the lessons learned from this type of a model using the framework in format of HealthMessages, but broadening it into other aspects of health literacy and other topics that we're interested in. So that kind of takes us full circle to where we're at now. So Project Search has received some funding, and I know Mary Ellen Daston's on the call, so I don't know if she wants to jump in and say anything more about this, but Project Search has partnered with Beth and Jasmina and the HealthMatters group to look at ways to glean more of that content out of the broader HealthMatters curriculum and fit it in the context of a Project Search program. And so there is an active partnership right now where Beth and her team and Ohio State University and Project Search are really looking at this piece and actively getting feedback from instructors and participants to think about how this type of a model could be expanded to cover other areas. And so these types of presentations are a great opportunity for us also to get the word out and to get feedback, because we know this is just one of many approaches that, that are being used to connect the dots between health and employment. And, you know, I think the topic of this particular presentation is about leadership and promoting health leadership. And really this model of this peer-to-peer piece, this ability to learn how to set individual goals, to model for your coworkers when you're out on an internship, you know, all of these pieces that are so integral to the way that the HealthMessages curriculum is laid out really boosts the leadership skills, boosts the self-advocacy skills of young people with disabilities. That was an overwhelming piece of feedback from instructors, that it just fits so nicely with other concepts of self-advocacy and self-determination and leadership, just in a slightly different content area than what we typically see in a Project Search program. But it did not seem to detract from our goal of employment and did not feel out of place for students. And in fact, they seemed really excited and found ways to integrate these concepts throughout their throughout the rest of their program. So we have been asking practitioners a series of questions as we've been doing this, you know, to get a sense of what folks are doing to promote healthy living in Project Search classes, what resources have been helpful, you know, how likely they are to include the focus of health in a program, and barriers to implementation. We're collecting that information now, and happy to also hear from folks on this webinar today, anything that you might have to share in addition to the questions that you have for us. But I think what I will do is sort of open it up for questions and comments. And Mary Ellen, I see you're on here, so I don't know if there's anything else you want to say in kind of wrapping us up, but I will leave the slide on with contact information for Erica Coleman at the University of Cincinnati. UCEDD is the lead for the Cincinnati 3 programs. Melissa is the lead in Rochester, and I'm no longer in Rochester. I'm now in Iowa, but still involved in this initiative as well. So, Mary Ellen, anything you wanted to add?
Hi, Julie. Can you hear me now?
I can.
Okay, good. Thank you. That was a great presentation. And really the only thing I wanted to say is that I'll be doing a presentation, you know, sort of picking up where you left off on the Ohio DD Council project in January. It's the last webinar in this series.
Oh, great.
So that's really all I need to say right now. We can open it up for the other listeners. Thanks again, Julie. That was great.
Thank you, Julie and Melissa. Now we will open to any questions. If you have, please put them in a question and answer box, and Julie and Melissa will get to them. If you don't have any questions, we're sticking around to answer any, but feel free to sign off if you don't have any. We do have one. Are the materials accessible to all communication levels, or do they need to be adapted?
That's a great question that I don't fully know the answer to. So, Jasmina, I don't know from a HealthMatters perspective if you could speak to that.
Yes, I can answer that. When we've tested HealthMessages and HealthMatters program, for the lack of a better terminology, we worked with individuals with mild to moderate levels of intellectual disability. However, since then, many different sites have worked with individuals with different, or participants with different abilities. We do recognize that the curriculums, that both of them are not end-all, be-all, or completely accessible for everyone. Especially with HealthMatters, we even have developed an appendix that helps users adapt some of those messages and lesson plans. So a lot of times people contact us if they get stuck on a certain lesson, and we are more than happy to give examples or adaptations for the lessons and lesson plans.
Yeah, and I would add, because I didn't say this in the Project Search 101, if there's anyone on the call that's not familiar with Project Search itself, that the Project Search programs are designed for students with intellectual and developmental disabilities. So, you know, when we think about mobility impairments and other types of disabilities, you know, I think we didn't specifically look at that piece in terms of accessibility, but certainly there's a lot within the curriculum, tips and tricks and ways to adapt it. I do think our instructors talked quite a bit, Melissa mentioned this briefly, that instructors, just as with any curriculum, have to know the students and the student abilities in their classroom and, you know, figure out how everyone is included based on where they're at. And so, you know, that piece is just something to consider.
Thanks, Julie. Another question we have, is this only for Project Search, or can adults use this, and how would you access the curriculum? I will put, the answer is no, you can get both curricula individually. The HealthMatters curriculum is available on Amazon, and I'll send that link to you, and HealthMessages program is available via our website. So I will just put it in the chat box so everyone has those links. Any other questions? Julie, I have a question. Did you need to do many adaptations?
I'm pausing to think about that, and actually, Melissa, maybe you could weigh in on this as well. I mean, I think we gave a little bit of latitude on some of the activities, but the curriculum itself, I think, was followed pretty closely. Melissa, did you want to add to that?
Yeah, I would agree with that. We actually did not need to make many adaptations. The curriculum has a lot of picture-based information too. And then for the students who were leading, you know, there was a script for them to read. The print is nice and large. You know, so occasionally they may have trouble with a word or whatever, but that's, you know, the support person is there for that. One of our classes had a deaf student, and he led the class by signing, and his interpreter did the talking out loud for the class. So no, I didn't find that we had to do anything really special to make it work.
Thanks, Melissa. Any other questions? All right, we will stick around if there are any questions. Please join us again on October 26th for Integrating Technology to Increase Student Interns' Health, Fitness, and Personal Responsibilities presentation at the same time as this one. Thank you all. We're just going to be here for a few more minutes to see if there are any questions. And please feel free to contact us after the presentation. We will email everyone with the webinar recording and the PowerPoints as well. Thank you, Melissa and Julie.
Thank you.
Thank you.
All right, we're going to sign off. Thanks, Julie and Melissa again.
Thank you.
Have a good day. Bye.
Thank you. Bye.